Have you ever heard of Wellens syndrome? Well, if you don't know what it is, you're certainly not going to find it, and it's ultra important. Wellens syndrome are EKG indicators, specifically in our anterior leads, V2 and V3, in the T wave, and they are indicative of an impending LAD occlusion MI. And as you know, that's called the widowmaker because the left anterior descending feeds the septal wall and the left ventricle, and that's really important in cardiac function. So it was discovered in the mid 80s when a bunch of cardiologists were noticing that they were seeing these wonky T wave signs in patients who presented with chest pain but didn't have any ST elevation. But then a few days later, they were all having these massive STEMIs and dying. And so then they did this test where they looked at about 1,300 patients who presented to the hospital with chest pain. They performed their EKGs. They isolated 180 patients who had these Wellens syndrome type changes, and there's two changes. Type A is going to be your biphasic T wave. Here's a 12 lead with a biphasic T wave in leads V2 and V3. Biphasic meaning the T wave is like, I'm gonna go up. Actually, I'm gonna go down. So it goes up, then it goes down. And as you know, in leads V2 and 3, the T wave normally in a non-pathologic patient is going to be upward deflected. Type B, here's an example of that. You're gonna have a super deep inverted T wave. See how deep that goes down, and it is symmetrical. So type A and type B. So they were able to look at 1,300 charts of patients who presented with chest pain who had EKGs on file. They isolated 180 of them who had one of these type A or type B criteria. They took all 180 of them to the cath lab, and wouldn't you know, all 180 had greater than 50% LAD occlusion. So here's what it means for you and I. If you have a patient, and normally these patients aren't the Hollywood like, my chest pain, my jaw, my left arm. Usually it's exertional chest pain that resolves with rest. As well, these patients do not have an elevated troponin, right? It waits until hours to days later after you see this Wellens syndrome. That's when these patients are going to have these massive STEMIs. So take it super seriously. Get these patients to a cath lab facility, and it's probably likely that you just saved the patient from a cardiac arrest a few hours or days from now. So there you have it, Wellens syndrome.